Chapter 1. Introduction. Reading comprehension is a fundamental skill in the learning process, especially in the health sciences, where the accurate interpretation of language used in verbal situations or technical statements can determine the success in interpreting and applying procedures. Within this context, grammatical categories play a crucial role, as they allow us to identify and understand the function of words within a sentence, thus facilitating the precise extraction of meaning. This chapter presents the background of the problem, the main question posed by the application of this program, the research hypothesis, the justification for the study, the objectives, the scope, and defines the variables necessary to understand the results of this work. For over 50 years, many nursing students have continued to study using traditional methods, such as summarizing, underlining, or highlighting key concepts to memorize them exactly as they appear in their textbooks or intervention manuals. This generally requires dedicating many hours a day, in addition to classroom time and hospital rotations for practical experience in real-life situations, applying what they learn from the literature. This traditional way of studying causes students in this specialty to place more emphasis on intervention procedures, such as administering injections, obtaining blood samples, cleaning, wound care, etc., neglecting the physiological concepts that underpin the rationale behind these activities based on the patient's pathologies. This situation is even more pronounced among nursing assistant students, a technical-level profession preceding the corresponding bachelor's degree. Background of the problem. According to Bueno 2018, unlearning is very complex for the brain. It is programmed to make new connections, but except for a very specific time in life, which is adolescence. This means that a new learning strategy for reading comprehension may involve having to stop doing what one is used to, writing summaries, memorizing, indiscriminately underlining concepts or main ideas, etc. Since most nursing assistant students typically begin their studies in adolescence, between the ages of 15 and 18, some institutions, such as the Industrial Job Training Centers, SICATI, also have students up to 50 years old. Because of this age disparity, it is appropriate to provide them with new learning methods for reading comprehension that modify or complement those they previously used. Typically, many people who study nursing do so out of vocation and enjoy the learning process because they believe it is necessary to apply it in the short term in the workplace or in their daily lives. Therefore, it is relevant to train them in new ways to understand lengthy and complex texts, such as books on anatomy, physiology, pharmacology, etc., as well as vaccination manuals and clinical procedure manuals. As noted, regarding reading comprehension, teachers must teach strategies sequentially and systematically, considering the educational level and the proposed activity Carrasco, as cited in Gasper, 2024, page 10. These strategies must be relevant and model learning processes so that students can put them into practice in all their courses. The study will have a quantitative approach and a quasi-experimental design. Problem statement. How does highlighting the grammatical categories of adjectives, adverbs, nouns, and verbs improve reading comprehension in nursing assistant students? Hypothesis formulation. H1. Highlighting the grammatical categories of adjectives, adverbs, nouns, and verbs significantly improves reading comprehension of health science topics in nursing assistant students. H0. Highlighting the grammatical categories of adjectives, adverbs, nouns, and verbs does not significantly improve reading comprehension of health science topics in nursing assistant students. Statistical hypothesis. H1 different to H2. H1 equal to H2. Justification of the study. Grammatical categories such as adjectives, adverbs, nouns, and verbs are fundamental for understanding the structure and function of words within a sentence, facilitating comprehension of the complete meaning of the statement. Therefore, investigating how the knowledge and application of these four categories can improve reading comprehension in the health sciences is relevant for designing pedagogical strategies that integrate language teaching with nursing. This will contribute to overcoming current deficiencies in the interpretation of clinical situations, promoting more meaningful, contextualized, and motivating learning for students. Furthermore, improving reading comprehension through knowledge of the aforementioned grammatical categories helps students develop skills to infer, analyze, and express ideas in the health sciences with greater precision, which positively impacts their learning and academic performance. Among the benefits of this subject matter are 1. Facilitating the structuring and understanding of written and spoken expressions, which allows for more effective and clear communication of health science topics. 2. Promoting the development of cognitive skills such as reasoning, critical analysis, and reflection. By enabling students to break down and understand the structure of clinical concepts. 3. Integrating linguistic and clinical learning, strengthening communicative competence and the ability to connect clinical concepts with everyday situations and diverse contexts. Therefore, most clinical concepts are presented in text format. So reading comprehension involves not only decoding words, but also analyzing, inferring, and connecting ideas to make sense of the situation presented. Furthermore, these are not isolated areas. They reinforce each other in the learning process and are fundamental for the student's comprehensive and cognitive development. This research could have a greater impact due to the enormous amount of physiological concepts that must be perfectly analyzed by nursing staff to understand the different pathological situations of patients. In addition to the fact that in the Sakati, the ages of the nursing assistant students are from 15 to 50 years old, and a large part of them have more than 10 years since they completed their basic or upper secondary education, so they do not remember the grammar, writing, and reading comprehension rules taught during secondary and high school. It is worth mentioning that an immediate improvement in reading comprehension can be observed by identifying the grammatical functions of adjectives, adverbs, nouns, and verbs. However, the most significant results will have a positive effect 6 months after starting the program, impacting all subjects within the nursing assistant discipline in a significant and lasting way. Ultimately, it will also contribute to the development of autonomous and self-directed learning styles by utilizing visual, color-coded for different grammatical categories, kinesthetic and auditory stimuli as students visualize, manipulate, and pronounce their new text productions. Research objective: to identify the extent to which highlighting the grammatical categories of adjectives, adverbs, nouns, and verbs improves reading comprehension in health science topics among nursing assistant students. Study delimitations. This study will involve a group of 10 students aged 18 to 30 years old from an urban area to determine the extent to which highlighting the grammatical categories of adjectives, adverbs, nouns, and verbs improves reading comprehension in health science topics. For this study, the dependent variable is the improvement in clinical reading comprehension among students. The independent variable is the grammatical categories. Study variables. Definition of variables. Conceptual variable. Grammatical categories. These are the word classes commonly recognized in language and classified according to their function within a sentence, allowing us to understand the structure and meaning of sentences. In Spanish, these main categories are 9: adjectives, adverbs, articles, conjunctions, interjections, prepositions, pronouns, nouns, and verbs. Concepto, 2024. Improving reading comprehension in health science topics among students. This refers to strengthening students' ability to understand, analyze, and correctly interpret statements and texts related to clinical topics, enabling them to identify relevant data, select appropriate concepts, and apply them in practical settings. This involves not only memorization but also understanding the context and specific language of the concepts to apply appropriate reasoning. Benavides and Zambrano, 2023, DialNet, 2024. Operational variable. Grammatical categories. These are didactic tools for inferring concepts in health science topics by identifying their functions in sentences. Improving reading comprehension in health science topics is defined as the ability to enhance interpretation, paraphrasing, execution, calculation, modeling, and problem-solving skills in practical nursing settings.